Hello everyone, this is the SmartGraft procedure we're showing you. So basically what we have done is taken follicular units from the posterior and lateral scalps where the hair is not prone to falling out genetically, and we're able to take those follicular units and implant them into the balding areas and the frontal scalp, temples, and the crown of the scalp. And those hairs that are taken will actually flourish and grow healthy and will not be prone to falling out like the other hairs in the area. So each follicular unit usually has anywhere from 1 to 3 hair follicles that will grow into healthy hairs. There is no scarring virtually with this procedure because the plugs are so tiny, so not like the strip method where you're left with a big scar. And also the survivability of the grafts is super important because this is a commodity that's not renewable. So you have so many hair follicles and we're basically redistributing those. So we want all of those hair follicles to survive. And the SmartGraft allows us to do that in a very gentle manner. And the procedure is done strictly under local numbing. So you will be awake for the procedure and very comfortable throughout. So once the follicles are implanted very gently and in a very natural manner, because we want to maintain a very natural, age-appropriate hairline, then right now I'm injecting exosomes, which are going to help the newly transplanted hairs actually grow even stronger and healthier. But also it's going to help the hairs that are just miniaturized in that area to also start growing. And so overall, you'll notice more density in the area, and you'll want to maintain that with a few more exosome treatments, a few months apart and periodically throughout the life of the hair. And that is basically the SmartGraft procedure. Please do ask us any questions, and I hope that this was informative and helpful to you. Thank you so much for watching.